That's the new intro. It cost me relatively $1.5 million to put it together. There's welcome to this last edition of Dental Bytes, last of 2023. I hope everybody's had an awesome year. It's been wild for us here at Dentist on Demand, a good wild. But without delay, I have some folks that are further down the coast in Santa Monica. Is that correct?
Yes.
Yeah.
So I'm going to let you guys say your names because I butcher them. So we have Dmitry and Sara.
Larbi.
Yeah, we went over this. See, I told you. I won't even bother. And Dolgov, the globes. Yeah. See, I butcher and make fun of my guests immediately just to break the ice. That's my thing. A little bit about you guys. Let's just get into your practice. You guys specialize in Airway, which is fantastic. I don't think a lot of folks know out there that they can go see their dental practitioner for airway problems. Obviously, this is a can of worms that I'm sure you guys will cover this in the conversation today. And TMD and occlusion and jaw positioning and all that great stuff. But I mean, this is taking years off people's lives if they're not addressing these problems early on. Is that correct?
Yes, very much so.
Yeah. So a little bit about let's hear about your practice. Let's hear about how, why you guys got into Airway, and I want to hear why you're passionate about it. It's a great topic.
Yeah. So we got into this because we wanted to find better solutions for our patients. Sorry, I
made you guys disappear. I pressed the wrong button. I do that. I don't claim to be a professional. So anyways, I totally cut you off. Go ahead.
No worries. Yeah, so a lot of it was our little path where we were trying to find better solutions for our patients, trying to answer a lot of their questions and being able to find the root cause to a lot of their issues. So we're not just airway centered, but we're also biological. Mm-hmm. So that has a lot to do with the materials we use, trying to figure out where the issues are coming from. Are they having a certain response to the material? But also making sure that the dental treatment we do isn't impacting their airway, because the mouth is the opening to the airway. So everything that we do focuses on how that may impact breathing and sleeping.
Sorry, go ahead. Yeah.
No, yeah. So we're also just trying to make a difference in actual patients' lives, because yes, it's great to get your fillings, get your teeth cleaning, but we want to do something a little bit more comprehensive and something that's actually going to change the person's livelihood and extend their life and overall health.
So how important is jaw position and occlusion? How important is that to long-term success of dentistry too?
Extremely important.
Yeah. I mean,
that's going to make a big difference with everything, really. Jaw position is going to affect the airway and also affect the bite. So if you have an uneven bite, if you have any fillings or crowns or any gum disease, it's going to make everything worse. If you have an unhealthy bite, your teeth are going to age prematurely. It's going to age a little quicker, and we're living longer nowadays. And I say the best dentistry is always no dentistry, because the more stuff we put in, the more likely it's going to start. We're going to have to fix it up and continue on that path. So if we have a nice healthy foundation, it can kind of alleviate any patient stress. Nobody really wants to go into the dentist when they're 60, 70, complaining about, broken crowns and fillings and receding gums and all that stuff.
Mm-hmm. And how important is, you guys are looking at the whole mouth then, single tooth dentistry, is a lot, I think, the root cause of maybe jaw, misalignment and that too. So I'm sure what's the process? What's the process with the patient then? When is it a questioning? Is it diagnostic? What's sort of that process?
Good question. So we every patient that comes to our office, we have a sleep and breathing questionnaire. So they have questions like, do you clench and grind at night? Do you have morning headaches? Do you feel tired? Do you wake up to use the restroom? Do you have blocked nasal passages? And that's all connected to the sleep and airway. So it's all also connected to the underdevelopment of the jaws. So the reason that we're having all these issues is that our jaws are no longer growing as they should. We're actually devolving. So back in the day, 400 or 500 years ago, we had very different diets. We were breastfed for 3 or 4 years, and then we started on hard diets of salty meats and roots, and to actually chew and use our muscles. Mm-hmm. And that process, we were able to grow out our jaws. So if you look at those skulls from that time period, and if you go to some Western or more of African tribe areas that don't have this Western diet, they have all great, broad, beautiful smiles. They don't have any airway issues. They barely have any cavities, no gum disease. They don't have any malocclusion. There's no orthodontics needed there. Mm-hmm. And so now, fast forward to now, we have this Western diet. We're breastfed for maybe a year. Some people are just fed. And so we are now, our mouths are a lot smaller, which compromise the airway.
So this is even from as short back as 500 years. We're seeing, we're de-evolving. That's crazy. Yeah. Wow. Okay.
Actually, studies actually show that after introducing the Western, after industrialization, the first generation, they already found a 50% incidence of malocclusion just through one generation. So after the second generation, it rose up to about 75%, and now we're almost at seventh and eighth generation. So your great-grandparents were also already at a 90% risk for malocclusion. That's why everyone, needs braces, has crooked teeth now. And the cultures that took on the Western diet first have, the a little bit worse teeth. So very evident, if we go to the UK, Britain, they're the first, the first country that really had all this, and that's why there's a lot more malocclusion noted there.
Yeah, you can go to the catacombs in Paris.
Yeah.
You'll start to notice. There's actually a book, Breath. Highly recommend it.
What's it called? Breath
by James Nestor.
Okay.
Kind of down this journey. He's suffering of this, as a lot of us are, our generations are. He kind of goes on this path, and he learns about sleep and airway and how our mouth impacts the rest of our body.
Right.
Why a lot of us have these symptoms, whether it's clenching, grinding, TMD, snoring, mouth breathing. These are all signs that we need to take very seriously.
No
Even
kidding.
snoring is normalized, but it's not normal.
Here, I found it on Amazon already. I'm gonna order it. That's cool. Wild. So, what do we do as a society then? This is like, obviously you're talking with patients that are coming in, and you're intervening with treatment. What do we need to do to combat us de-evolving then? Do we need to be eating different? Do we need to?
There are a lot of really good resources out there. There's also a book called Baby-Led Weaning, which it kind of introduced hard foods to babies, what kind of foods, definitely breastfeeding, and also going to providers that are familiar with this stuff, familiar with tongue ties and underdevelopment, all that stuff. So when we treat both children and adults here, children, they're still growing, so we can still, still get them to the 100% healthy smile. But we have a groated that's a tongue twister.
It's okay.
Guided growth development program,
yeah,
where it essentially kind of grows out the patient's mouth as they should be.
It basically helps guide growth for children to their full potential. Adults, it's hard. We can make some improvements to where we're at, but for kids, we can actually help guide them, and that means they might not need braces, and maybe their wisdom teeth even come out. And of course, a solid food diet, no mushy foods. We want to really build out our jaw muscles, and our jaw structure.
So what the heck can I do as a 41-year-old to ensure that probably let's not get fat, and good luck during Christmas time. But what can I do to help make sure that I have my airway and everything is optimized into the future.
I mean, we also, so a couple other things that we look at in that first visit, we also do like a 3D scan,
Mhm.
an iTero scan. We're able to look at the bite, so we're able to see where the teeth are positioned. Are they angled towards where the tongue is positioned?
Mhm.
We also do CT scans. We look at where the bone's hard tissue and the soft tissue is.
Mhm.
The most simplest form, you can actually use clear aligner to upright the teeth
Mhm.
and create more space within the mouth. And then the soft tissue component is something called myofunctional therapy, which I'm not sure, many people might not be familiar with this, but it's kind of a physical therapy for
Okay.
your tongue and your facial muscles. It also helps tone like your airway.
Is
But
this
a lot
sort
of
of like an orthotic progression, or is that something complete? Am I an idiot there?
That's
the other part,
that's another
part of it.
part.
Yeah.
So
Yeah.
this is specifically looking at like facial muscles and tongue.
Okay.
position. But orthotic, you can talk more about that.
Yeah, so
Yeah.
there are treatments for adults. So there's obviously the surgical route where you go in, get surgery. They kind of break your bones and wire you shut. So
Yeah,
give
everybody
you-
wants that, right?
Mhm.
So not many people want to elect to do that surgery, but there's also great research and studies that are showing that there's actually removable appliances
Mhm.
that can grow, extend the bone.
Yeah.
They promote new bone growth and can actually give you more bone in your jaws. So it's a little bit of a longer process, but adults can definitely, there's a lot of studies out there that adults can definitely still grow the bone, because earlier studies are showing that the bones kind of seal at 12 years old, but they're talking about the cranial bones and those. There's actually a study out there that's showing that the bones of the maxilla and mandible, the sutures still are not all the way sealed, so they can still be changed.
There's still more to learn with like stem cell research and all that.
This is it's such an interesting topic. I've followed it over the years. It's, when it comes to the jaw joint too, especially, the body's reaction to malocclusion, it's pretty significant, like headaches and crepitus, like popping, clicking.
Mhm.
It causes folks a lot of anxiety and trouble out there, doesn't it? And I read a stat somewhere that is it somewhere up towards like 25% of the population suffers from some degree of sleep apnea and airway troubles.
Mhm.
So,
It's higher than that.
how does one how can one self-evaluate and I know you shouldn't be self-diagnosing ever and seek professionals, but I mean, obviously that's a lot to do with your questionnaires, but I'd love to send you everybody in North America to come and see their, and get some help. But what can folks do, and where can they go if they're experiencing these issues?
Self.
Yeah.
So the questionnaire is definitely kind of, you can ask yourself if you have these symptoms. There's the questionnaires with the blocked nasal passages and not feeling well rested in the morning. But it's very important if you come to us, we see that questionnaire. We also take a look at the mouth and how everything looks, and we usually recommend a sleep test. We actually do sleep screenings here at our office. It's a sleep ring that's FDA cleared, so we send the patient home for a week with the ring, and we want to see 3 nights of data. Then they come back in a week, and I really kind of thoroughly go through the report with them and show them what I'm seeing and how everything could be connected.
Mm-hmm.
Sorry, go ahead.
No, you guys go ahead. You guys are the important ones here. I'll always do a good job of jumping in and interrupting, but yeah, let's hear. Sorry. Go ahead.
When finding a provider, you definitely just have to do your own research depending on the area you're in, depending on what state, how many providers in that area.
I just think it's such an underserved, segment. And I think does that have a lot to do with the studies and the science and the unknown for treatment? Would you say what's stopping every every dental practice out there from offering a service like this?
I think it's just not well known enough, really. I think a big problem is also that if you go to your primary care provider, they don't have much time with you. They're with you for 10, 15 minutes, and not very often do they ask about how you're sleeping, because all these issues that come from sleep, you know.
And I mean, our healthcare system doesn't really allow healthcare providers to go in depth. That's why we started our practice, because we want to be able to sit down with our patients and ask them about their diet, their sleep. I mean, a lot of patients are surprised. They're like, why are you asking me about my sleep? Why do you care about what I'm eating? But we're trying to piece things together so we can better understand why your mouth looks like the way it does, and your mouth impacts. You can't have a healthy body without a healthy mouth. Your mouth
for sure.
tells us a lot about what's going on systemically.
Yeah, I mean, obviously, it's self-promotion when we talk about how important oral health is to overall health. There's all sorts of science that supports that. It's not just like a blind claim. It's legit, especially when it comes to Airway. I'm up here in Vancouver, Canada. So our two systems, we have universal healthcare up here, and dentistry runs, outside of that coverage. So up here, I feel like it's kind of a disconnect in between. So you need to go get that sleep study. That's part of it. You need to be diagnosed with, whatever that is. And it seems like there's a lot of back and forth up here when it comes to that. And then, what do we do with these folks after they're diagnosed? Like most cases, I just give them the CPAP machine.
And compliance is 30%. So you're not going to wear your CPAP, but that means you're not getting oxygen. You're not breathing.
Yeah. So compliance with CPAP is 30%.
If that might be a little
probably high.
That might be a little higher. It might be like 20%.
Wow. Yeah, I honestly know a few folks that have the machine that don't use it. And it's, hey uncle, you're taking years off your life. And I'm sure they're making it as comfortable as possible, but I can't see it being all that comfortable wearing that thing around your head. I think, obviously it's an amazing solution for folks if they wear it, but I think it's great what you guys are doing, like developing this and getting to the root of the problem and intervening from sort of like a dental clinical standpoint. So let's hear some success stories then. This is the good part. So there must be some folks that have come through experiencing, even headaches or, just pain, and they're not sleeping. It's all tied together. Yeah. Let's hear some happy stories then. Let's hear some.
Yeah, I actually have a great one.
Really quickly though, I do want to just mention, with this CPAP, you're married to it for the rest of your life. And then if you stop using it, you're not getting the oxygen you need. Yeah. And then second thing is, one of the appliances that we actually use is FDA cleared. So it's getting recognition, and I think it's going to be a solution for a lot of people that's going to be implemented soon everywhere.
Because I know night guards, putting a night guard on somebody, it's like putting a skating rink on their jaw, could in some cases make it worse, correct?
Exactly.
Yeah. Bulky, they take up more space in the mouth. That's only pushing your tongue back into the airway and creating more of an obstruction. I mean, it helps protect your enamel and your teeth, but it doesn't really solve the root cause of why you're grinding and clenching to begin with.
That's what a sleep appliance is for. Right? It's titrating the mandible into place and keeping it where it needs to be, right? So back to you touched on the CPAP. I go on tangents, but the CPAP machine, is there sort of negative long-term effects of that too? I mean, worst case is they're not using it, and it's they're not getting the oxygen they need. But in terms of like the anatomy, is it disrupting, wearing that 8 hours a night? It must be, right?
I think that the biggest thing is that your body likes to adjust to things.
Yes.
So over time, we also get weaker. Musculature gets weaker, and it's not really solving it. So it just, the thing is, as time goes on, you might have to increase the pressure for the oxygen to get down there.
Sure.
So you have to be kind of titrating it up constantly. So it might be actually making the disease worse over time, but you're still getting that relief.
Yeah. I mean, I guess that's all part of it. Like I had a pharmacist on last week, and I think a lot of our solutions are just kind of like best case scenarios, and it puts a Band-Aid on things. So having the ability to intervene and allow the body to do what it needs to do to correct itself, right? That's where you guys come in.
Yeah. Our healthcare system is very reactive.
Yeah.
It's like, oh, you have a cavity, let's put a filling in.
Yeah.
Well, why are you getting cavities? Why do you continue to get cavities? That's not normal. We've normalized it. Let's get down to why this is happening to you.
I agree. I think it's like, isn't it human nature to be not proactive and just reactive of things? Yeah. But I think that comes, with education and the right systems in place, and allowing people to flow into these things like we need to be. Like we're not living as long, like you guys. There's multiple things working against us, and that's also due to the system that we've put in place too, right? So, this is super interesting. So, how long have you guys been practicing this? So, like, what? It's
been about 2 years.
Okay. Yeah. And now, are you getting in the area? Are you getting referrals coming your way from other folks and stuff? And
yeah. Yep.
We're getting a little. We're getting some more people. We had somebody fly in from San Francisco, driving up from maybe San Diego area. So
I think it's word of mouth. It's word of mouth mostly.
Yeah. And did we discuss that happy story?
No.
Yeah. See, like it's Sara. It's your fault this time. Jeez, it's not. I didn't do it this time. That's awesome. Let's hear this story. I want to hear this story.
Yes. So I had a patient come in, actually a pretty young female. Went through the questionnaire. Blocked nasal passages, poor sleep, having coffee. Just looked very tired, honestly, when you look at her. And when we're young, we're not supposed to be that tired. And obviously, as we age, that's just going to get worse. So we had to do something. So we did the sleep study on her, and she started treatment, actually. So after she started treatment, she saw results pretty quickly. So she reported that she started dreaming again. She no longer needs coffee in the morning. She actually lost, I think she said 10, 15 pounds. And then when you look at her face, everything's like full of color, a lot more blood flow going. She just feels so much better. And that's so really, really cool to see. Nothing that it's really rewarding, because she comes in now very, very happy, satisfied. She's down to do, whatever. She's ready for the journey. She loves it.
That's amazing.
I think it's cool to impact like the patient's overall well-being.
No kidding.
Like, they just feel good.
Well, right there, that's why you guys are doing this. That's pretty cool. Like to see that firsthand. That's amazing. What else could you tell me? Like, give me another story. I want to hear more. Like, this is really cool. And you're onto something when you're having that kind of result. That's so cool.
Mm-hmm.
Yeah, and I have another patient that same thing, came in. She was also a younger female, started treatment. She's been in treatment, and she was also very tired looking, was not getting sleep. She would sleep for 10, 12 hours a night, but still need a nap during the day, had coffee, didn't have any energy to really exercise, started treatment. So she was starting to sleep through the night. She didn't really need to take any more naps, started going back to the gym again. So she, looking better, like lost some weight in that aspect. Also, she had the poor nasal breathing. She always used strips, and recently she said she stopped using strips because she can breathe pretty well through her nose now.
So the strips are just, they open up yeah, okay. Yeah. Okay. Yeah. I don't know. You lost me at not drinking coffee anymore. That's, I don't know. That's 2 in a row now. I think I'm out. Kidding, obviously. This is so great. So, if you can impart anything to your colleagues about this subject, where to go and learn more, from your experience, what has been enlightening? What book? What what philosophy? Where did you start on this journey, and how help your colleagues get into it here?
Great question. So definitely a good intro is Breath by James Nestor. Definitely read that book. That definitely got me into it. But then we joined something called the Vivos Institute, and that's all about kind of the appliance that's helping, address that craniofacial underdevelopment, which impacts the airway and breathing and sleep. And so they've been coming out with a lot of studies, a lot of data, showing the impact it's had. Mm-hmm. And that's kind of the protocol we follow here. And that really just got me into the field.
Yeah.
Cool. And now, what are you telling the folks out there, the patients out there that are aware or are not aware? Like, is there a solution? Like, it sounds like there's a solution. What would you tell them?
I mean, of course, it's case by case. There's so many different factors that can be impacting airway and sleep. We definitely can provide the dental perspective from anatomy, but I think something that we really harp on is education. So any patient who comes in, they get a long list of books to read and videos. There's actually one, it's a nice TED Talk. I need to remember the doctor's name, but it's actually by a neurologist. I think it's something along the lines with how a misfit mouth impacts your, I don't know. So I need to look it up, but we just have the link and we send it out to everybody to watch. So a lot of like self-education, so that our patients feel empowered to take charge of their health and understand what they're feeling. And it's also like a collaborative approach. Like even though we're doing these sleep studies, we're collaborating with sleep doctors to do the diagnosis. So, and that's something you mentioned before. Dentistry has been forever kind of separate from medical field. And we try to make an effort to reach out to these providers to get our patients the care they need. We're going to handle the dental perspective, but we need a team of providers to get this patient back to health. So these patients that Dmitry was just talking about, like whether they see a physical therapist or an ENT, like a chiropractor,
chiropractor,
or sleep doctor. So it's a team of people who we're kind of help facilitate that. Yeah,
specialties working together for the and it's so important. Like you talked about it, it's the patient has to be an advocate for themselves too. I'm sure there's things that they need to be doing in order for it to be successful. I mean, case in point, CPAP, 25%. Yikes, right? And then, we all get to these problems. We're reactive. We get a solution and we still don't follow through. Oh, jeez.
Yeah.
That's wild.
And it's not an overnight solution. It takes time. So they have to be willing to commit to this journey.
Well, especially when it comes to like orthodontic like progression, right? Like they're probably going to have to wear like a day appliance, and in some cases they have to learn how to eat with it. I can't imagine that being very much fun, but I think if you have to be motivated to want to get better. I think if we look at that in terms of anybody going through anything, like if you want to get out of it, you're going to be stuck in a holding pattern with whatever it is in life unless you want to do something about it.
Yeah.
Right. I want to live, I want to live healthy. I don't know. Maybe some people just think it's too much work to live healthy. I don't know. But if you have like an easy solution, Is it like excuses? Is it excuses that we don't? Is that what it is? Is it like human nature or the human body? We're just we're built to consume energy and like conserve it and not hit the treadmill, right?
Yeah, I think everyone just wants a quick fix.
It's the times we're living in.
Yeah, true.
Everything is click away, and
like the systems we've built, I think, just aid to that too. Like we can turn the wheel and now we're filling up on a massive amount of calories that we just ordered 30 seconds before that. We tap our credit card or debit cards, and we're eating this stuff on the passenger seat as like driving away. It's it's awful to say, but like it's kind of like putting a gun to your head, is it not? But I think is that programmed into us. Like we talk about going back 500 years. Like we fought to get those calories, right? We fought to get those calories, and now we're just like, it's so like we got it easy.
Yeah.
And that process isn't even nutritious. It's not even doing us any good.
What do they call it? Like empty calories, right? Where really it's giving us like quick energy, but really it's destroying our bodies. But it just tastes so damn good. So what do you do?
Yep.
Yeah.
I'm going to get a Big Mac right after this, right?
I'm craving something.
Now that I'm talking about that, I want myself a milkshake. And anyways, this has been really awesome. I like to keep these more towards a half an hour. How do folks find you? How do folks come and see you? We'll start there. Where should someone start if they want to say hello?
So our website is thedentistlounge.com.
Okay.
And then we also have an Instagram, the.dentistlounge. That's the best way to reach us via email or text.
You can book online. You can take a look at the website.
Oh, look I'm like putting myself in the corner here. I've got it up here, but it wasn't popping up. I was like trying to be all smart. There we go. There you are. And this is where I was like, I preemptively like went and I was going to ask you guys this, and it's Dr. Sara Larbi. I'm so sorry. I just put you down as Sara. See, this is like, I'll always embarrass myself. I've just learned that it is what it is. It is what it is. Let me fix that here. See, we learn as we go, So there's a reactive, not proactive approach to being on DentalBytes. Give me some imparting wisdom, some closing thoughts. What's been on top of mind? What are your goals for the new year in terms of the practice? Where is this specialty going into the future? Where do you see it 5 years from now?
I see this becoming very much larger. I think a lot more providers are going to start learning more about this because, we all went into healthcare wanting to help people, and this is truly the best way we can actually help people by educating ourselves so we can educate our patients. So the ADA already passed something in 2017 recommending that dentists screen for sleep disordered breathing. So it's catching on. I see this like really becoming more prevalent for sure. And then for our practice, we're excited. Yeah. There's so many, of course, like cool gadgets but like more importantly, like just learning more. There's so much more for us to learn. It's overwhelming. There's a lot.
Learning more, providing more services in-house, making everything very comprehensive so we don't have to send out here and there. So we have a lot of growth to do.
You're creating your own fast food easy access process. That's smart. Yeah. Thank you so much, guys. This has been awesome. I'd love to have you guys back on in 8 months or 6 months to see how things are progressing. I think this specialty, I agree. I think it has a lot of legs. I think there's a lot of people trying to figure it out. It's cool that you guys are figuring it out, and it's pretty awesome.
Yeah.
I do have one more thing. One more little tidbit that I can add.
You can have three. You can have three.
One will be enough for now, but it's significant.
Okay.
So we highly recommend that patients, well, depending on the patient, try mouth taping at night.
Mouth taping. Yep.
Yes. So mouth taping is becoming more mainstream. It's not only good for your dental health because you get cavities if you sleep with your mouth open, pH drops, saliva dries up, but also it greatly increases sleep quality. So nasal breathing induces, the parasympathetic nervous system. So you get that, that good rest. And when you start breathing through your mouth, it kicks in a sympathetic drive. So by tricking the brain, putting the mouth tape on, that's a quick little easy fix, as we could say, to help improve sleep quality. It can also help sometimes with patients clenching, grinding.
Cool.
But
I would go ahead, Sarah.
Yeah. We have to say a disclaimer. We say tell our patients, but if you have trouble mouth taping, then you need to see an ear, nose, throat doctor, because we get nasal breathers.
Yeah.
If you cannot breathe through your nose, then we need to find out why you're not able to breathe through your nose.
Yeah. I can't remember who I was watching. It was a doctor, a throat nasal doctor, was talking about, how important our nasal passages, as we take in air, it prepares the air for the lungs too. He said something like the oxygen that we're able to absorb has been climatized. So we're actually, as a nasal breather, you're giving your body more oxygen too.
Mm-hmm. Yeah. It warms the air. It's bactericidal, fungicidal, virucidal, and it also releases nitric oxide in your body as well. So there's so many benefits to nasal breathing. I mean, look at all our furry animals. They all breathe out of noses.
Oh, yeah.
It's true. Yeah. Even, the older you get, you become a furry animal, Awesome, guys. Well, Merry Christmas, Happy New Year, Happy Hanukkah, whatever you're celebrating. I hope you guys have a lovely holiday. You guys going to take any time off to relax and be with loved ones, or?
We'll have a few days.
Yeah,
just a couple. Yeah. You guys sound like me. There's just no rest. Come on, give yourself some rest. You're telling everybody else too, right? Yeah.
Thank you so much.
Right.
Thanks for having me.
Yeah, and I'd love to have you guys back on. I think this is a great topic. I think more of us need to be talking about it to promote it. And thank you for giving me the opportunity and your time to talk about this. It's been great.
Great.
Thank you. Thank you so much.
You're welcome. See you next time.
See ya.
See ya.